Hello, my name's David Redfern. I'm a consultant orthopaedic surgeon specialising in the foot and ankle and co-creator of the Mika minimally invasive bunion correction. I'm going to tell you a little bit more about that operation and through a series of other videos, a little bit more about the decision making and the post-operative period. So if you have a bunion, you're in good company. A large proportion of the population, somewhere in the region of perhaps 20 to 30%, have bunions, and many of them don't ever contemplate surgery or perhaps never quite get there in terms of deciding to go ahead. And that's entirely reasonable. There are two reasons I tell patients why you might consider surgery. The first is that the bunion is currently painful and affecting your quality of life, and people often say, the bunion itself hurts in footwear, is limiting in the choice of footwear, and can also hurt during activity. And quite commonly people say it hurts when they're running or undertaking sport. And it's a personal decision as to whether that is sufficient intrusion to then contemplate doing something about it, because surgery in whatever form is still a big decision and entails a recovery and some risk, even though we as surgeons minimise that, and you as patients do your bit in doing as asked to minimise those. There is still some risk. The second reason is if that trajectory of symptoms seems inevitable, and a lot of people say to me, well, my mother has or my grandmother has severe bunions, and shouldn't I be doing something about it? And if you already have symptoms, they're probably not going away. So it might become a reasonable decision to go ahead, even if your symptoms aren't quite at the stage where you feel I've got to do something about it, because it's a complex equation. So it might be time off work, might be holidays, whatever it might be. It's a complex equation of home and family and office that come into decision making and being able to accommodate the post-operative recovery. So we'll, through the next few videos, just try and explore some of those topics.